physical game. A monster jam by Blake Griffin.
It cost basketball player Blake Griffin his Olympic hoop dreams. Many everyday athletes feel his pain. A torn meniscus is one of the most common knee injuries.
It's usually a twisting injury while the knee is bent. I mean, there's quite a few ways to do it. Sometimes we don't know exactly how they do it, but the most common way is with it flexed or bent and putting weight on it, and it pinches it in such a way that it tears it.
Which is why it's frequently seen in sports. The ligaments keep balance across the knee. A torn meniscus is often a result of a poor landing.
You'll see it very commonly in most running, jumping oriented sports, soccer, football, even baseball and basketball.
A torn meniscus causes pain, stiffness, and swelling. People will sometimes feel a popping sensation. With rest, ice, and medication, it will sometimes heal itself.
We treat it without surgery if the tears are small, but a lot of times we have to do what's called an arthroscopy, where we go in through the small incisions with the camera, and most of the time, if the tear is not too big, we just take out the part that's torn and they don't have any ill effects, but sometimes we have to repair it with some sutures.
The procedure is done on an outpatient basis, but patients can expect to spend some time on the bench.
Usually it's a 6-week recovery if it's not a big tear. 6 to 8 weeks.
While it may be a season-ending injury, a meniscus repair leaves little or no lasting effect, leaving patients to get back to the game of life. For Lee Memorial Health System, I'm Amy Osher.